This week's episode is another that we recorded in person from the BAYADA Preceptor Summit, and we were joined by Kaylee Wilson, their Divisional Lead Preceptor for the Northeast. Kaylee breaks down how BAYADA selects and supports preceptors, the training involved, and the impact this has on clinician success and retention. If you're a preceptor, have ever been one, or lead a clinical team, these insights will be incredibly valuable. Let's get into it. All right, we're back with the Suit and Scrubs podcast.
Hey,
Very
everyone.
excited. You guys just finished a presentation that I think went really well. So nice work.
So, with the BAYADA Preceptors.
Yeah, we just did some presenting on burnout reduction, improving efficiency within the home health setting, and for all the preceptors, which I thought was good. Seemed like it was well received.
And we stole.
I was just going to say we stole a guest. So Kaylee Wilson.
Yes.
And you want to tell us a little bit about yourself, your role, and what you do at BAYADA?
So I am a registered nurse, and I'm the Divisional Lead Preceptor for our division. So that is all of Massachusetts and Rhode Island. And then we also remotely support New Hampshire, Maine, and Vermont.
Oh, okay.
So that's a good amount of geography that you encompass.
Yes.
That's
a good
impressive.
number of preceptors,
Yeah.
probably.
So
Yeah.
are you traveling to these different states for training preceptors, or are you training new hires?
So a little bit of both. So when I first started with BAYADA, I was the primary preceptor for all of the nurse residents. And then my role changed a bit where I now support the preceptors, but I also am a resource for my designated offices. So I meet with them once a week. They let me know if they have clinicians that are struggling. And so I can either bring them into a skills lab and work with them on skills that they're struggling with, or if there's like a documentation piece that they're really struggling with, I find out what they're struggling with and then create resources for them so that they have that to kind of go off of.
I think that's absolutely amazing.
I know.
That amount
It's
of
so
support
nice.
is amazing.
Support
congrats
for the
to you guys
support.
for doing
Support
that.
for the
Well,
Yeah.
truly. I mean, it's
Yeah.
like no one can fall through the cracks. I mean, they're identifying and they're helping solve it before, because as you know, it's a different language when you get into home health and there's a lot to learn
Mhm.
and it takes months to get there, right? So
Yeah.
Yeah, how do you identify who's going to be the right fit for a preceptor? Do they kind of do they volunteer or do they get identified?
So BAYADA is a huge organization. And so each office runs almost like a franchise. And so they come to us, the education team, and they say, I want this clinician to be a preceptor. And so it's kind of based off of their recommendation, but then we, look at their documentation, and we kind of know these clinicians because we directly support these offices. So one of the, four of us will either say, maybe they need a little bit more work. And that does happen sometimes where we'll do a documentation review of this potential preceptor and we'll say, that's fine. They can be a preceptor, but we're going to work with them a little bit before they kind of are in that role.
Do you have anybody that they're like, really, really want this person to be a preceptor, and that clinician is like, I don't want to do that?
We do. We get that a lot of times.
Yeah.
So sometimes it does take a little work to, I hate to say convince them, but sometimes clinicians say, I don't have the time for that. I don't have the patience for that. And then it's, we have a whole process when we get these clinicians that become preceptors. So if you're precepting somebody, the expectation of points or visits is reduced.
That's good.
And so just, giving them that information,
Mhm.
just letting them know,
Absolutely.
the expectation
Plus
is not your full caseload
Mhm.
and then precepting somebody. And so a lot of the times then they feel that, oh, okay, well, maybe I can do this.
Yeah.
And just knowing, you're going to be precepting, but I'm going to be, here to support you supporting this new clinician.
Yeah.
So they have that support.
I've been a preceptor a few times and have kind of been just thrown into it. I've never gone to any preceptor
Same.
training. It was just kind of, hey, 6 p.m.
You
the
seem
night
like you know
before.
what you're doing.
Like, Lisa, can you go, can this person follow you? And I'm like,
Yeah.
what are they following me
Mhm.
for? Am I training them? Like, what do you want me to do?
Yeah.
It's like, oh, they're going to be with you for 6 weeks. Like, oh, okay, like, sure.
Right.
But I feel comfortable that I know like the documentation system and I know the best practices that I can teach all of those things. But it's do y'all do like a preceptor training?
We actually do.
Yeah.
that's so
I figured that would be the answer
Yeah,
based
I
on this
figured
summit
based
so
on
far.
it.
Yes. So
Right.
we do. Once somebody has been identified, an office identifies a clinician that they want to be a preceptor, we sign them up for the preceptor training. And so it's a 2-hour by Zoom training, and it just kind of goes over the expectations and, kind of how the whole process is going to work. Just more of guidance, because as we know, every clinician is going to be different. So we can't, say this is exactly how it's going to go, but just kind of introducing them to their role. BAYADA does, they have incentives. So your clinician stays on for X amount of days, you get this bonus. And then at this point, you get that bonus for the whole year. So just kind of laying it all out there, what the expectations are, kind of how this goes in the preceptor role.
So a good incentive to improve retention. Yeah,
Right.
that's huge.
I think
Yeah.
a big shift towards employee retention is huge, like focusing on the clinician. And I think BAYADA is kind of trying to start shifting that way, or how it has shifted that way. Because I know employee retention in home health can be very, very difficult, because
It is.
not for everybody. But if you have a good preceptor that can kind of show the ropes and these tips and tricks, I think it really, really can help.
It does. It makes a huge difference. And BAYADA is great where they do a lot for their employees. And so I just came back from North Carolina. There's a conference that they do that's White Shoes, and it's a leadership conference. And it's just really nice. You go there and we all joke about drinking the Kool-Aid, because you leave and you're energized and you're like, oh my gosh, I love
So
my
nice.
job. My coworker,
awesome?
it is.
Mhm.
And so my coworker that I was with, we're driving to the airport, and I was like, I stayed an extra day, and she was going home, and I said, I wish I was going home because I want to go back to work. She was like, what?
Are you okay?
I know. Yeah. But I was like, I just learned all of these great, tips and tricks that I can go home and I can use, and I can, pass that on to my clinicians and things like that. So us creating this Preceptor Summit, this is year 2 for us. But it is a way to show that appreciation to our preceptors, because I know that you guys weren't there for my introduction today, but I let them all know that today is all about you, because if you don't feel, I've worked for many companies that you don't feel appreciated. It's almost like you're just a number. And sometimes I'm like, would anybody know if I was even working today? Except if it wasn't for my patients calling, like, where's Kaylee? Sometimes you can feel so alone. So, and you don't feel, get that appreciation. So we are trying. We heard from the practice president yesterday and today that he does want to try to make this a practice-wide thing, the Summit for Preceptors, which is amazing because we're nationwide. We're actually in other countries too. So it's really exciting, because we need that. Preceptors are the future of every organization. So it's super important.
And probably a key role in retention. And you touched a little bit on some of the incentives that you put in place, for however many days their new hires are basically stay with BAYADA. And so for me, I always approach things kind of from the non-clinical business side. So when you look at your preceptor program, I assume you're sort of tracking and to see, hey, the new hires with these preceptors, stayed on for X number of months, so I assume you're tracking all of that stuff to identify where there might be opportunities for more training for one of your preceptors who might not have the retention that others have, or how do you track that?
So we do spreadsheets, lots of spreadsheets. But so we have our preceptors, but then we also have what we call lead preceptors. And so it's almost, you have the office preceptors, which could be a number of clinicians. And then we have one lead preceptor for an office, and then the divisional lead preceptors. And so when we identify these preceptors that are excelling in their clinicians that they're training, we do see, we're retaining those. That's when we say we've identified you as probably the lead preceptor. So it is nice to be able to track that and see, and then give the support to the other preceptors that maybe aren't having the best retention.
And of course, it might have nothing to do with whatever their role was in that new hires journey, but at the same time,
sometimes
the
home health
patterns
is not for everybody. You don't know that until you get into it.
There's Sorry.
I was gonna say, you hear like home health is so great, it's flexible, I have all this autonomy. So you're like, yes, that's for me. And then you get into it, that might not actually be for me, even these things. So
Well, and you heard too, like I remember yesterday at that conference, they said one of the folks was saying, you almost take it personally as a preceptor when someone doesn't last. And
Yes.
I imagine that happens frequently. Take it personally.
Yeah. So when I was doing the nurse residency program, that was really hard. And so you have these brand new nurses. They've never worked a day in their life as a nurse. And then you put them in home care.
ooh,
So you take this baby and you put it on an island by itself.
Baby on an island.
Yes. Essentially, right there, you're these little green nurses. They don't even know how to be a nurse. And never mind walk into this stranger's home and know the answer to every question they're going to ask you. Right? It's
don't
impossible.
have the support that you would in other places. Like I'm in a hospital, I have the support of other nurses around me. Like, yes, we have a phone, but you can't just start calling in the middle of a visit. Be like, so what do I do for this? Like, you're like, all right, I'm just going to have to make my best clinical judgment as I can, and I'm going to learn from that.
Right. And that's where for me, it was the whole first year that I was at BAYADA. It was actually a grant that was how they were able to bring me on and to do that nurse residency program. But it was like one by one, the nurse residents were like, nope, I'm sorry, home care isn't for me. And I was like, what am I doing wrong? You know? And it was very hard to understand that maybe it's not me. It could be me, right? But I've done everything that I could. And they always would just say, you know, I appreciate everything that you've done, but it's just home care is not for me. And it's not for everybody.
Home care was not for me either. Like when I was in PT school, I'm like, oh, I'm going into outpatient physical therapy. Like that's where I'm going, sports. And then I was like, there's two things I'll never do. I'll never do home health and I'll never do peds. And then I was like, oh, well, I've gone a few years in the SNF, and then I learned about home health, and I could go in assisted living facilities. And that's where I started. I was just ILFs. So I was like, that's kind of different. I'm not going into people's homes. Then I moved to Texas. I was forced to move to Texas. And I was like, all right, I'm going into homes now. And I just kind of had that mindset shift of like, I can do this. And I love it now. It's like the greatest thing. But it's not for everybody.
It's not. And even when I have one of my best friends is a nurse in a hospital, and I keep trying to tell her, because now she has her first daughter, and she's like, these 12-hour shifts aren't working for me. And I'm like, I'm telling you, you should come to home care. She's like, I can't go into people's homes. I'm like, you can. You just have to get past that. It's weird at first, right? You know, but that now it's something I don't even think about.
Not at all. No. You just show up like, this is great. I love being in your home, like 99% of the time, right?
Yeah.
But because you're in their home environment, everybody's more comfortable. It's just, I don't know.
So you talk about the baby on the island. So do you, does BAYADA have a perspective on recent, like new grads getting directly into home health? Do you have a special sort of pathway for that? Or do you recommend a period of time in outpatient before you come to home health?
So BAYADA actually has an entire nurse residency program. And so they have this program where you go through orientation separate from the traditional new hires. It's a whole different program, lots of extra support. They are making changes to it constantly. I am a little bit more removed now since I don't really focus on the nurse residents, but they have a skills lab in New Jersey. So when you join the nurse residency program, regardless of where you're located, they're flying you out to that skills lab to have that, you know, one-to-one in-person training. And it's a ton of extra support. Yeah. So they're trying, they're still trying, you know, it's hard though. It is. So it's almost like, you know, you have that baby. So you're trying to give that baby all that support you can, because they are so green and, you know, just trying to give the extra support seems to help. It's still hard. It is.
I wonder if there's, I assume you have like retention metrics for new hires versus experienced folks. And is the skills lab and the residency program must be working to some degree. So there's, for people that are listening that are new to, you know, just recent grads, home health is an option as long as it's done with the right support structure.
Exactly.
Yeah.
Yeah, I think
Yeah.
it definitely is an option. I didn't know about home health at
Me
all.
neither, yeah.
I also worked in a SNF.
Mhm.
I was an LPN, and some nurses were leaving. And I'm like, what do you mean? Where are you going? We're going to home health. I was like, you're going to go to people's houses?
Yeah.
And they were like, yeah, the flexibility. And I was like, stop right there. Sign me up. Flexibility. I have kids. You talk about getting your kids off the bus or on the bus. That's the same thing for me. And so I think the biggest thing is you don't know about home health as a brand new nurse. I don't know about therapy, but I didn't have, in my clinical rotations, I didn't do home health. Nobody really
Right.
talked about
It's
home
same.
health.
It's hard to get a clinical
it's-
rotation.
Yeah. So, and it's not, I would never deter a new grad from coming into home health. It's just knowing, this is not something that is going to be easy. And I don't think any new job as a new grad is easy. It's going to have different difficulties than, other facilities and things like that. But as long as you have the support,
Yeah.
it definitely can be done.
Yeah, I think keyword support, because of the obvious reason that you just said. I mean, you're, especially for a newbie, someone who's brand new, I think the scary part is, okay, I'm going to be in this person's home. I'm not going to have anyone to reach out to, and so when you're supported with a robust, like well-oiled machine preceptorship program, I think that just makes such a big difference.
Do you guys touch on, I know Dan, when he's, was presenting today, and the two of you guys touched on, charting in the home is an art, and it's obviously difficult to teach an art versus a science. So how do you tackle the, efficiency and, some of the different, how to schedule and how to talk to a patient? I mean, is all of the soft skills touched on? Yeah.
That's a great question. Well, I'm sorry.
No, it's okay. No, it's okay.
Go for it. You go, and then I'll say what I have to say.
No, I was just going to say they are. But so I am very passionate about education. I'm actually working towards my MSN in education right now.
Nice.
And it was something that I was going to school for my NP. And then I got this position and realized, wow, I love education and teaching. And so in order to be a preceptor, I feel like you have to, right? You have to have the patience, and you have to want to. I have all this knowledge because I've been in home care, for 10 years. And I want to share that knowledge with you because I know it's really hard right now. But let me tell you, the struggles that I went through are the same struggles you're going to go through. And here's how I navigated it.
Beautiful.
But you also have to understand that everybody learns differently. So one of the things that I do is I have that conversation on day one. How do you learn? Because I learn by doing, but you may learn by, me telling you what to do. And so it's understanding how clinicians learn, I think, is the most important. And, maybe in the beginning, you're going to just watch me. And you're going to watch how I do things. And then we're going to sit together afterwards. I'm going to go through a visit like I normally would. And you're going to watch how I do it. And then we're going to go to Starbucks or Panera, wherever we're going to go. And we're going to sit and we're going to document everything that we just did in that visit. And then maybe tomorrow you're going to have my tablet and I'm going to take the vitals and you're going to enter it. So it is kind of easing them into it. And you want them to see how you do everything from calling the patients, from the scheduling and everything thereafter, so they can, see it be done in real time.
All I was going to say is, I feel like for my program, when I became a, home health PT, I think there's such a focus on dotting the correct I's, crossing the correct T's, which is very important. You have to know the important logistics of how to document accurately for home health. But then the other part of it, which is also how to survive, right? And how to give yourself some grace, and how to work with curveballs and to reduce burnout, because it's, as we talked about today, it's an important thing to talk about. Strategies to, I think giving yourself some grace, and hey, schedule a little bit of time for lunch, because you're going to find out everyone's like, no, you're not going to have time for lunch because you gotta hustle. We go through different parts of life that, I was talking about in my 20s, I worked differently than my 30s and my 40s and 50s. But I think, when you hit on some of those things, that's really important.
Yeah. And you're not 50 yet,
Not yet.
but you know how you're going to operate then.
It's coming.
You're planning.
Planning on being there someday. Maybe 5 years. We'll see.
Is there one thing that you really try and tell a new hire as a preceptor, like to really drive that point home? Just
I
know there's a lot. There's
Yes.
a lot, but is there
Yeah,
one
I
that-
just think that the biggest thing being a preceptor is them understanding I've been in your shoes.
Mhm.
I, did travel nursing for a while, and you're just thrown in. You don't really
Mhm.
get an
Yes.
onboarding
I've been
process,
through.
and it's just like do it.
One day.
Yeah,
Or 2 days.
yeah,
Yep.
and they're
then
like,
you're
here
going.
you go.
Yep.
My first experience in home care, I was a brand new RN, and they were like, great, you're going to be a hospice nurse. And I was like, I am?
What?
Wow.
Okay. All right.
Wow.
So
my goodness.
I was like, I don't care what position you give me. I want to work in home care with all this flexibility with my
Mhm.
kids. And this
Mhm.
sounds lovely. Even if it means that I am helping patients die. All right,
Mhm.
we're going to do this.
Mhm.
And so my preceptor was a travel nurse.
Mhm.
And so
Oh my goodness.
I was like, yes, exactly.
Mhm.
I didn't know the extent of that at the time
Yeah, of
until
course.
I'm,
Until-
week
Yeah.
2 on my own. And I was like, I
Hmm.
forget what she said, and I went to call her and she's not answering. And I call my office and they were like, oh, her contract ended.
Oh my
Oh, no.
gosh. Wow.
You're like, wait, she
Okay.
was my
Yeah.
help.
I know. So then I'm like,
Now
I
what?
don't have support now, So I just think that support and,
100%.
letting them, those clinicians know, like, I've been in your
Yeah.
shoes and, this is kind of how we're going to handle things.
That's awesome.
Yeah, the support. I know when I graduated PT school, I started in the SNF, and I walked into my first day expecting, some training. I was like, here's your schedule.
Mhm.
And I was like,
That is not
okay,
how to
like
do it,
fake
yeah.
it till you make it. Like
Yeah.
I'm going to see patients. I have no idea what I'm doing and I don't know how to document anything, but like, here I go. But I had kind of the support around me. I could not imagine going into home health with no support.
Mhm.
Yeah.
You wouldn't make, I wouldn't have made it. I had a really great preceptor program when I first started. I'd have been a PT for 4 years. So I knew PT, but I didn't know home health.
Mhm.
Mhm.
Right. And I would always tell my people I'm training, like, I'm not training you how to be a PT. I'm training you how to do home health
Mhm.
because
Right.
you know how to be a PT. It's just
Mhm.
all of the other stuff that goes into home health that we need to figure out together.
Yeah. And we always say we get, plenty of clinicians that come to work for BAYADA and they have experience in home health. And so they're kind of like, oh, I don't need this. And we're like, oh, no, you
Mhm.
have to learn the BAYADA
Yeah.
way.
Yeah.
Yes.
Yeah.
And I've worked for different agencies doing the travel nursing and home health, and every agency does things a little different.
Mhm.
Even if you use the same documentation
Mhm.
system, it's utilized a little bit differently.
yeah.
So yeah, I'm not teaching you how to be a nurse.
Yeah.
I'm just
Yeah.
teaching you how to do things the way that BAYADA expects
Right.
you to do them.
And when you're not trained maybe effectively, like you learn practices that probably aren't the best practices,
Yeah.
and so then when you learn the BAYADA way and you go through this robust training session, I mean, you're taught the right way right off the bat. Even if you've been an experienced clinician, you learn this is how we do it.
Yeah.
Yeah.
Mind tell
And
Jordan.
Huh?
I was just thinking of this
Yeah.
is how we do
Yeah,
it.
you-
That's
Sorry.
That's exactly it. That's exactly it.
But
Yeah.
before we end, I was thinking about you talking about the different agencies and how different agencies might do it. And we know that, more folks that are in agencies and maybe more administrative positions are starting to listen as well. Do you have any advice for a smaller agency that doesn't have the breadth and scope and resources that a BAYADA has, on how to build a preceptor program or what are the best practices to make sure that you're actually delivering the support that their new hires need?
I think the most important thing is communication and touching base with your clinicians,
Mhm.
right? I want somebody to ask me how things are going, how I'm feeling.
Mhm.
And a lot of the times, and that's how I am as a preceptor. And I think that's the most important thing, right? Because if you have a clinician that's really struggling, but you're not reaching out, like, how is this going? How can I support you? Do you need to do less visits? Things like that. That's when, that retention starts to be
Mhm.
impacted. But if you have nurses that are thriving and you can kind of really put all of your effort into a nurse that can be a great leader,
Mhm.
that you can then hire new employees, that you can, use that clinician that you've really put a lot of effort and time and support into. They're going to carry that onto your new hires and then kind of shape the future for the agency, because they're going to kind of pass that down. It's almost like a trickle effect,
Mhm.
It's
great.
perfect.
Love it.
Well, thank you so much for one thing, for inviting us to participate in the summit. So we got to do a couple days of presentations. We got to do the giveaways of the new trunk organizer that is made to BAYADA spec, which is exciting. So helping us with that. And then we kind of rolled out the smoky house kits. And then spend time with, all of your preceptors, and you appreciate the time that you took with the podcast today.
Yeah. Thank
Yes.
you all. This
Thank
was
you.
great.
Yeah,
Good
thank
to
you
have
for
Yes.
you
being
on.
here.
Yeah.
Appreciate it.
Thank you.
Thanks
So-
everyone for listening.
As usual, we'll see you guys next week.
All right.
Huge thanks to Kaylee and the entire BAYADA team for welcoming us and sharing their expertise. Remember to visit caremotion.co to access our shop, resources, and full podcast library. Thanks for listening, and we'll see you next week.